Hello, and thank you for joining us for the Sage Intech webinar, HIPAA Through the Eyes of a CFO. We'll be discussing what HIPAA compliance means to healthcare CFO Michelle Naus and why Tri-County Mental Health Services needed their accounting software solution to be HIPAA compliant. We'll talk with CFO thought leader Jack Sweeney about the changing role of the CFO and provide a look into the advanced financial analytics healthcare organizations are leveraging that include personal health information. Joining us today is Michelle Naus. Michelle is a senior level management and accounting professional with healthcare, nonprofit, governmental, and startup experience. She has extensive expertise in finance, management, strategic planning, and corporate governance, as well as tactical expertise in the execution of process creation and improvement initiatives. Jack Sweeney is the host and creator of CFO Thought Leader, which features interviews with dynamic finance leaders that are tasked with driving change within their organizations. He is a career business journalist and founder of Middle Market Media LLC, a leading creator of on-demand content serving middle market business audiences. I'm Brian Boji. I lead the healthcare vertical at Sage Intech, and I've spent the last 18 years working in all aspects of the healthcare ecosystem, from drugs and medical devices to consumer health and healthcare IT. We'll be answering questions at the end of this webinar. Please use the Q&A box on the left of your screen to type them in. For questions we are unable to answer during the webinar, we will answer via email. Before we get started, there are some terms that you will hear during the discussion that you should be familiar with. So to get started, what is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act of 1996. It was passed to improve the efficiency and effectiveness of the healthcare system. The Act created national standards for electronic healthcare transactions and code sets, unique health identifiers, and for protecting the confidentiality, integrity, and availability of electronic protected health information. Included in HIPAA, there is the privacy rule, the security rule, and the enforcement rule. HIPAA rules apply to covered entities and business associates. Covered entities include healthcare providers, health plans, and healthcare clearinghouses. Fines for violating HIPAA can range from $100 to $50,000 per violation or per record. There's a max penalty of $1.5 million per year for each violation, and you could also face possible criminal charges and jail time. During this webinar, you'll hear about business associates. Business associates are persons or entities that perform functions that involve the use of protected health information on behalf of or to a covered entity. For example, Sage Intech is a business associate of Tri-County Mental Health Services. A business associate agreement is a contract between a covered entity and a business associate that establishes specifically what the business associate has been engaged to do with PHI and the standards of protection of PHI by the business associate. Sage Intech is the only mid-market HIPAA-compliant cloud accounting solution, and to demonstrate our commitment to comply with HIPAA, we'll sign a business associate agreement with eligible healthcare clients. So Michelle, tell us a little bit about Tri-County Mental Health Services.
Okay, thank you. Tri-County Mental Health Services is a nonprofit 501c3, and we are a provider of mental health services, behavioral mental health services in northern Kansas City, which is in Missouri. We have Ray, Platte, and Clay counties in Missouri. We are also a Certified Community Behavioral Health Center, or a CCBHC. We are considered a safety net provider of these services, so most of our population population is individuals with severe mental health, mental illness diseases, and substance use issues that come to us as the provider of last resort. And so we're a large provider of Medicaid as well as uninsured populations. And so we receive money from the state in order to provide those funds, as well as the county and federal government in order to best serve the population in our area. And being a nonprofit, we're always aware of, are we doing the right thing and using our money in the right way, because there's not as much of it to go around as maybe there would be if we were a for-profit. But I think what's most important to note as a nonprofit is you still are really operating a business, and you need to look at it from a business perspective and not just think it's okay to have a loss or it's okay just to break even, that it is actually okay to make a profit in a traditional 501c3.
So, Michelle, when we're talking about HIPAA compliance, as a CFO, what does that mean to you?
I think HIPAA compliance really deals with keeping the information the most secure that you can, whether that's just dealing with your consumer or your patient on a one-on-one basis with what's in their medical record, or also protecting the information that's in the financial records that may identify them as a consumer of your services.
And why is HIPAA important to Tri-County Mental Health Services?
So for Tri-County Mental Health, HIPAA is obviously important just because we're under the federal regulations where we have to make sure that we are in full compliance with HIPAA to make sure that we continue to participate in the Medicare, Medicaid systems. But then also, it's really to protect our consumer base. So our service population are those individuals that have gone through tremendous mental trauma, may have substance use issues, as well as just a stigma that has followed them for all of their lives. And so any kind of identification to us becomes even more crucial than just protecting the PHI that is required under HIPAA, but it's also protecting the fact that they're a consumer or a patient of ours, because just your employer or your family and friends knowing you're getting mental health services, sometimes that stigma will follow you around and cause more trauma in their lives.
So, Michelle, when we were talking before about Tri-County, that's a very sensitive population based on those diagnoses. Mm-hmm. Do you have any other feelings as to why beyond the stigma?
I think it's just, not only the stigma, but also the sensitivity around what's happened in their lives. We're finding out now that trauma-informed care is something that goes beyond just a diagnosis of mental health. It deals with how things happened in their childhood or how things happen in their workplace, and that really drives, what do people know about you and how do they look at you, and do they treat you the same as they would if they didn't know. And sometimes we forget that information is hidden within our data analytics that we do, our financial reporting, and just even cutting a check to a person from our agency. We have to be sensitive that they're receiving a check with our logo on it, and how would that be interpreted to that individual?
Very informative. We also have Jack Sweeney. Jack is the host and creator of the CFO Thought Leader, which interviews dynamic finance leaders that are tasked with driving change within their organizations. Jack, tell us a little bit about yourself and about CFO Thought Leader.
Yeah, thanks. Thanks, Brian. Well, I am a career business journalist, came up through the ranks in magazines for different industries. And a few years back, maybe 10 years ago, actually, when the print world was still alive and kicking, I was editor of a magazine called Business Finance Magazine. And was fascinated, never thought finance was a place for me necessarily, but when I got there and discovered how the role of the CFO was really changing, and how there were new technologies that were going to, take things 3 yards further. It became kind of an interesting place to be at that time. And CFO Thought Leader came about as the media landscape changed. I wanted to create a platform where CFOs could access content from their mobile devices and hear stories from other CFOs about how their worlds were changing. And podcasting began to take off with mobile devices. So we quickly created a platform as well as a regular podcast. We post 2 a week now where we speak to different finance leaders about how they're driving change within their organizations. What are they up to? What are they doing? And, of course, compliance and regulation has always been part of their world, and it is today.
So, Jack, you've interviewed more than 400 CFOs from different industries, including healthcare, pharma, insurance, hospitals. What are you hearing from those folks today?
Well, as I mentioned, it's an exciting place to be at this moment in time. Finance leaders suddenly have the ability to measure different aspects of the business, and they're looking at the business through many different lenses. Some are getting focused on the customer experience. Others are getting focused on the workforce and all the costs associated with talent and keeping a healthy workforce. And they're coming up with new metrics in regards to how to measure that. And that's why I think with Michelle here today, it's just such a great opportunity to ask her about the KPIs that are top of mind for her in this area of healthcare and the workforce. Michelle, what would you share with us?
So yes, we are definitely utilizing more information from our electronic medical record, our EMR. That is where we really keep the detailed patient information that is HIPAA protected as far as Social Security number, diagnosis, all of that information comes out of that system. And so we're able to pull certain KPI indicators such as our units that we're providing in a specific service. We're slicing the population and looking at certain diagnoses from a certain zip code to make sure that we are targeting the community and providing the types of services that they need in that community. And then we take those KPIs and we blend those with our financial data to really look at where are we spending the cost. Are we costing where we need the service, or are we spending too much in areas that are administrative or not providing that kind of service that the community needs? And so really trying to dig down and making sure that when we're spending money and we're looking at our finances, that we're doing it in a focused approach that really ties in the community and the diagnosis.
So Michelle, that's really interesting. When you talk about the additional areas that you're looking at for analytics, we've always said that CFOs have to spend much more time not just being the curator of what's happened, but also looking into the future and being the decision makers, helping to guide what's next. Can you talk a little bit about how that role has changed for you?
Yes, definitely. And I think that's when you think of traditional accounting, it was always reporting on the past. You do an audit, it's your past history, it's the past information that's occurred. And I think now that systems are much more robust and do some of the day-to-day activities, like when we did switch to Sage Intacct, a lot of the reconciliations that were very manual in nature in Excel were made very quick and just more efficient with the new system and the new tools, and that frees up your time to really look toward the future and say, okay, great, we've got some good historical information, but how do we use that information to drive our budgets forward, to look at reforecasting and making sure that we're being a proactive leader. And I think that the CFO role has evolved to where it's really more of a strategic partner with the rest of the organization. I've been in healthcare finance for over 25 years and was an auditor in my previous life. And so really like and enjoy kind of breaking down the components of the delivery system in our organization and understanding enough to where I can bring in the financial side and try to project out what could we do differently if we use this money in a different fashion. And I think that's what the new CFO really looks like. It's somebody who's trying to look more into the future by using some historical information, but not relying solely on the fact that all they're doing is reporting.
So, Jack, given what Michelle has just said, how does that line up with what you're hearing from the CFOs that you're interviewing as well?
Yeah, it's interesting because there seems to be this parallel between HIPAA and, in fact, the role of the CFO. I mean, while HIPAA rules have been in place for years now, the focus of their application has changed as technologies and practices have changed. And similarly, along that same period, that's where we see CFOs beginning to become more strategic and participating in discussions where they hadn't in the past and get involved at a certain level. And it all comes down to data. Today we see finance leaders studying different parts of the business and really trying to make that data visible, which is what Michelle was sharing with us. I mean, that was interesting, some of the KPIs she mentioned, how they're side by side now for her, and which is wonderful for decision making.
So, Michelle, a lot of the information, as you gave that example, combining the EMR with the data that you have in your Sage Intech system, your general ledger, allows you to create different types of analytics and data. Given that what Jack was just talking about on how that's evolving, how do you see that evolving as well over the next few years?
I think it becomes more and more of a game changer and just something that's expected as well. Before you could say revenues fluctuated up or down, and you might be able to talk in very generic volume ratios. So you might say, well, we saw 3,000 more patients in this particular area, and that's what drove our revenue, which is still a valid statistic to use to describe fluctuations in revenue. But then as we look more and more specific into healthcare revenues and talk about value adds and are we doing what's right for the population, it's going to become more important to talk about specific diagnosis and really make that statistic line up very closely with the exact unit that was provided for that piece of revenue that you're creating. And so you really have to understand the complete breakdown of what your business is doing versus coming in at a very high level and only looking at it from that standpoint. And so when you're digging down deeper into the information, you really need a good, consistent way to kind of pull all that information together so that you can step back and really look at a visionary level and see what you need to do next. And so for us, it's really getting a good handle on what statistics are available, how do we tie it as closely as we can to the revenue or to the expense numbers in the financials, and then produce something that a clinician can take and deploy. And so really understanding that you have to flip finance talk into clinical talk so that you can make it something that's useful, because we can all produce wonderful analytics that go nowhere because they're really not helpful. So trying to figure out what's the one that's helpful for everyone else.
That's excellent. Jack, what I'm hearing from both you and Michelle is more data, more types of data, but also the right data. Talk a little bit about the right data, Jack. What are you hearing on that?
Yeah, so it's never visible at first, but you really, what we see is finance leaders are going out and exploring and collaborating and actually speaking to the executives who are, what's most valuable to you? What can you use to be more effective to do your job? So when you mentioned to me the right data, I just know that finance leaders have their antennae up, trying to understand the types of information that can best support the organization at large. Brian, and I don't know if that's exactly what you're asking about, but that's what we see.
No, that makes sense. It's making sure that, in the plethora of data that's out there, that you can run different examples to find out and pinpoint exactly what data is important to the organization and what you can use in order to statistically look at the future and be able to project in a great way. And, one of the things that we hear a lot is the timeliness of that data and how often you have to report out. So, Michelle, tell us a little bit about that, the feeling and the need to report and decrease the time that it takes to get those reports out to key stakeholders.
Yeah. So definitely you have to report each month, how the financial results were. That's a given. I mean, that's something that's been out there for decades. But what becomes more important is being able to quickly get the information out in real time so that adjustments can be made or not made. And so just even this morning, I was having a discussion with our CEO about the fact that we really need to get information in the hands of department managers that they can look at the productivity of their staff and really understand, are they deploying resources in the most efficient manner that's providing the best impact to our community. And so that's always, when we make a decision, and that's in the back of our mind, how do we impact our community? How do we assist the whole person in getting everything that they need from us and from their healthcare community? And so really we need to be able to provide that information on a real-time basis to those individuals. And the word real-time is something that's hard to define because there's no such thing as instantaneously having every piece of information you need, but how can you close that gap and get it as real-time as possible so that a manager or a supervisor can really make the best decisions on how to deploy resources for the week. And so for us, sometimes that's the most important is figuring out in healthcare your biggest expense and resource is your personnel, and how do you most efficiently deploy them to serve the community, serve the purposes behind your organization. And for us, it's really trying to figure out what is our statistics at that moment. And so that's what we utilize our systems to try to accomplish.
Jack, I'm sure you're hearing the timeliness of reporting as well. What are some of the examples of data that CFOs are reporting out to, and how important it is to get that in as near real time as possible?
Yeah, real-time data, and again, just helping, sales reps, or it's just an example, but making certain they have the right information in real time to whether they're pricing something or whatever it might be. And, of course, this relates to the workforce as well. When you need to make decisions, you want that data to be the most timely it can be. And to strive towards that, there's a technology piece of it, and there's a greater effort across the organization to collaborate and make numbers more available. So
that's great. So, Michelle, one question for you on the data that you're pulling and the HIPAA compliance part of it. How important was a partner that would sign a business associates agreement, and why?
So it was vital for us to be able to move to a financial system that was in the cloud, and we're trusting that that information we're putting in there is protected, is one of the most important things to us, because our reputation really is the most, important thing when you're providing a consumer or a patient with services. You want to make sure that they feel comfortable with you, because a lot of these individuals have had circumstances in their life where they've not had trust for us being in the mental health side of healthcare, and so we have to build that trust. And so if we were to have a HIPAA breach, besides the financial impact that would come to the organization from, fines and repercussions, just the reputation damage would be very difficult to overcome because that trust would be broken with our consumers. And for us, all of our data is tied to some sort of service delivery. It may not have complete identifiers available to us. We may have actually encrypted the data so that it doesn't all come over, but it does have a component of HIPAA somewhere in everything we do, whether that's cutting a check, whether that is pulling over revenue data from our electronic medical record, it's in there. And so for us, it was mandatory for us to move to the cloud in order to have that HIPAA certification was a requirement.
So we've heard a lot from both Michelle and Jack about HIPAA and why it's important and the types of data and KPIs that are being measured now. So let's take a look into the future. Jack, tell us a little bit about compliance. It seems that it is becoming an increasingly vital role to the CFO position. What are you hearing from the industry?
Oh, yeah. I mean, it has been, right? And only more so as visibility within organizations. I mean, you can no longer afford to have a compliance snafu. Whereas in the past, these things could be repaired. But as we move into what we've been talking about, this more real-time environment, these regulations are part of your planning. These regulations, you need to be able to detect when an operation needs to modify its behaviors or whatever it might be. So as we talk to CFOs, what we're hearing is that there is no longer a tolerance for certain snafus. Visibility, the data streams create this wonderful visibility. If we're not leveraging it the way we should be, we cannot be strategic. We cannot move forward. So it's that visibility which is only helping finance leaders solve some of the regulatory hurdles they've faced in the past. And in looking forward, again, it's going to solve a lot more of ease their pain points, their regulatory pain points is what they're telling us.
Sure. Things like Sarbanes-Oxley, XBRL, GDPR, and even some elements of GDPR that are coming to the U.S., those are incredibly important. And Michelle, you said something earlier in the conversation about trust of your patients and the need to make sure that you're providing the best care that you possibly can. Talk a little bit about compliance with HIPAA and how you weigh those pieces.
Yeah, I mean, I think HIPAA for the CFO is essential because most CFOs, like myself, sit on HIPAA compliance committees. And so we are not only utilizing the data and the information and making sure it stays secure, but we're part of the team that has to look at any kind of breach and decide what are our next steps. Did we do everything we can to keep it secure? And I think for us, at Tri-County, we've done a really good job of making a compliance plan that's a living plan. Many people develop a plan to check a box. They put it on a shelf. They don't move anywhere with it. And for us, our plan is a living, active, breathing plan that we are constantly looking at policies to make sure that they are safe for our employees internally, and we're keeping everything we need to, but also looking at it from the lens of our consumer. Are we providing them the right information when they're requesting it, whether through a health portal or through, a paper request? And can we go back to them with a straight face and say, we have done everything that we can to make sure we've kept your information secure, and really keep that trust with them? And I think that's what it boils down to. You have to be able to look the patients in the face and say, we've done everything we can for you to make sure that your information is safe. And what's bad is that when you have to go back to somebody and say, we didn't do our job right, and now you're at risk for your information being leaked and given to the public. And we see that all the time with some very large organizations, whether that's, internet providers or organizations that are very much in the public eye on the credit card and consumer side. And so for healthcare, it's even more scary for an individual to think somebody might have their information and might do something with it and it cause damage to them. And so for us, it goes beyond just reporting the numbers. It goes to providing that integrity, which is something that is basically a staple in accounting. If you're an accountant, you want to do everything with the utmost integrity, and your name is what goes on those financial statements. So in this case, your name is going on the organization as well, and you want to make sure that you've done everything you can to put the right face out there.
And making sure that you keep that trust and you comply is more important even than the fact that you could face fines or even criminal prosecution for any breach.
Exactly. I mean, that's the most important thing. I mean, I'm not going to lie, the fear of going to jail, I think, is very good indicator that people are going to do the right thing. Nobody wants to go to jail for something. So I think that scares most people into doing the right thing. But I think the bigger thing is, you have to be able to live with yourself and your community. And if you're not doing everything that you can as an organization, as a trustee of the funds and the community, then why are you doing what you're doing? You have to kind of step back and look at it from that perspective.
Jack, Michelle makes an excellent point about the integrity not just of the organization but herself as CFO. Talk a little bit about how you're seeing that become more important as the role of the CFO continues to change and evolve.
Oh, yeah. And that's something that I think has been a part of the CFO role, deep into the last century. I mean, employee surveys have revealed that CFOs are frequently the most trusted members of senior management teams, and it's clear why. They sign off on the numbers, and that has always been an important role. But as they move into these new areas and these compliance areas specific to individual employees, protecting privacy, they would be the right executive for the role, for sure. And I think, again, it's a sort of a historical role that they've played and established. And if you look at company cultures today, the CFOs very frequently play a very important role in establishing trust throughout the organizations. So I think that should underscore that point nicely.
So as we look at the future, why HIPAA will become more important to CFOs, there are really three things that are top of mind. There's keeping up with the evolving HIPAA regulations, whether it's the move to bring state regulations into line with federal regulations. There's discussions now about how to change HIPAA regulations in the future, and they're meeting to discuss that now. There's the advanced analytics piece, where we heard from Michelle about specific KPIs that we're looking for in order to best run the organization, in order to provide the best care possible. Things like cost per patient per day, revenue per caregiver, and so forth. And then there's changing payment models. We're going from a fee for service to an ACO/capitated/value-based revenue recognition. And I know, Michelle, you're going through that now. Can you talk a little bit about that, please?
Yeah. Tri-County Mental Health is one of the Certified Community Behavioral Health Centers, CCBHC centers in the state of Missouri. That was a federal program that started July 1st of 2018 that really changed the way community health centers deployed their services. And so it moved everything from fee-for-service to a PPS, or a prospective payment system, that is a per-visit, per-day model. So you're basically providing a face-to-face service, and you're issued a payment for that day based on providing that face-to-face service. And so everything you do during that day is covered by that one payment that you receive. And so it became kind of a trick to be able to provide the services that your consumer needs, but not to provide them in mass. Like, don't give them too much that's too overwhelming for them that day, but then also to balance the revenue side of it, because if you're getting paid one payment per day, what's the best value that you can provide to that consumer, but yet provide the balance in the net income perspective for the organization. So it really kind of took that step back, moved us more to a capitated type plan, but then we have a cost report that we prepare in order to compare our costs to our expected revenue. And so since we're doing it in advance, that's where the prospective payment comes into play.
So Jack, as CFO evolve and their position continues to change, do those things, the regulations, the analytics, and the change in payment models, reflect what you're hearing from the CEOs that you've interviewed?
Yeah, without question, and change is just the constant. So it's always in regards to new regulations. Where are we on this, and what do we have whether they dedicate people resources or part of the team to it. But they have sort of a their whether it's a weekly or monthly meeting where they talk about the challenges that lie ahead in the next 30 days even. So they're very top of mind. Revenue, how revenue is recognized, and how that's impacting both privately held companies and publicly held companies. That is where they've really pulled the trigger on some very, I would tell you, fast break accounting teams, and doing their best to get what used to take many months done in just days. So in any case, yes, these are changes the constant, and how they were tackling these challenges is daily now.
Thank you, Jack. So, Michelle, a couple of questions that came in, want to check in with you on. Can you tell the audience what types of PHI you're entering into the system?
So into the Intact system, we're actually entering in, if a person is a patient of ours, that is a patient type as a vendor, because the refunds we might issue somebody would come out of our Intact system. Or we also provide services to our consumers because of the nature of behavioral health. We might provide them with a stipend to purchase clothing to get a job in our employment services, or to assist them with rent or utilities, depending on the type of services that they're receiving from our case managers. And so because of that, the vendor identifies them as a person receiving services from us. It will have their address, phone number, all of those things that go into a vendor record, but it does definitely identify them as a person receiving services. As far as coming in from our electronic medical record, that's where the diagnosis lives, as well as all of that case management notes and the medical record information that's protected on that side. That does not directly interface into our system. However, if they are receiving services in a certain area, our GL codes are departmentalized. So you could back into where did that payment come from. It's from psychiatric services. They must be a consumer in psychiatric services. So that is the type of information that gets into the financial records.
And Michelle, you've been an expert in healthcare for a long time. So one of the questions is, what did you know about HIPAA before going into the selection process for a financial software solution?
So I started in healthcare in 1995, so that was pre-HIPAA. So I was working in public accounting when HIPAA regulations started to be deployed, and so basically reading from the beginning, what should we think of in deploying each step of HIPAA, because HIPAA was not all of a sudden something that was deployed. It was deployed in steps, and so each regulation as they've been entered, I've been able to see how that's changed and affected our healthcare organization. Used to, you could walk down to medical records if you were auditing or reviewing a chart, and you would open it up and there would be pictures of maybe the injury that occurred. Well, that's no longer allowed under privacy regulations. And so things like that have changed the way that the internal service is delivered, but I've been able to see those develop from more of a clinical side to the security side, and now it affects not only financial security, but it also affects, electronic and information technology. We're now starting to see more of a push for cyber insurance to be purchased from an organizational standpoint, and so that's something that has become very real, a very real cost that everybody is able to evaluate each year.
So if you were going to give some advice to the audience about where to find HIPAA information, where do you go to keep on top of things?
Mm-hmm. So I think there's two great resources. One, everybody's a member of some professional organization, and so those professional organizations have a great wealth of information that they've collected from the peers, from other like organizations, and provide it in a very relevant manner. But then secondly, the OIG website. And so going directly and looking, what is the OIG work plan related to Medicare, Medicaid compliance, and taking that work plan and really saying, okay, how does this affect our organization? And so that's a great strategic task for the entire compliance team in an organization to do, and that can be led by the CFO, or it can be a CFO as a member of that organization, but you have to look at what are the hot spots that everybody's looking at, and how are we working to make sure that we have covered those hot spots.
Fantastic. Michelle, if you were to give some advice to CFOs around HIPAA and creating their plan, what would those quick thoughts be?
I think definitely to know a little bit more about it. I think it's easy for some individuals to think, oh, that doesn't affect me. That's more for our compliance team, or that's more for our clinicians. It does affect everyone, I think, is most important. But then second, use your business partner. Your business partners as much as you can, whether that is your, financial system, such as Intact, Sage Intact, asking, what kind of things have you seen, or what can we do differently in the way that we're entering data? I think it's reaching out to your financial statement auditors, to your attorneys, to anybody that you really work with, and understanding, what are their concerns or what are their ideas that they've seen with other clients that they work with. Because sometimes I think as an organization, you think you can provide the best of everything, and you forget to turn to others and take from them some ideas and goals that they've set for themselves and deploy those with your own.
Jack, that was some great advice from Michelle on how to make sure you are staying compliant with regulations and also utilizing the relationships that you have. What would you say to CFOs about staying compliant and using their business partners?
Yeah, I would just underscore everything she just stated. It's just that's a perfect snapshot, and that's often what the items that finance leaders should keep top of mind. She just said. So I have little to add to that.
Fantastic. Thank you for joining us today for HIPAA Through the Eyes of a CFO. And thanks to Michelle Naus, CFO of Tri-County Mental Health Services, and Jack Sweeney of CFO Thought Leader for their valuable insight. For questions that we were unable to get to on today's webinar, we will be emailing you a response. For additional information on Tri-County Mental Health Services, CFO Thought Leader, or Sage Intech, please see the resource list on the right of your screen, or visit our website at www.sageintech.com and learn more about the #1 accounting software solution built for finance by finance, the first and only AICPA preferred financial management solution that's #1 in customer satisfaction. Thank you.